You're watching StratNews Global. I'm Amitabh, Revi, and I'm really glad to be joined from the capital and not from Luxembourg that we were trying for quite a bit by Mr. Luc Provost. He's the CEO of B Medical Systems. Mr. Provost, I know you are extremely busy and in between meetings, so really appreciate your time.
Thank you for inviting us.
And also, Deputy CEO of B Medical Systems, Jesal Doshi. He's, of course, been schooled in India and very familiar with Mumbai. Am I correct with my research, Mr. Doshi?
That's right. I am a Mumbaikar.
Thanks so much for joining us as well. Mr. Provost, I know it's going to be extremely busy. You're moving from Delhi to Mumbai to Ahmedabad to Pune as well. But just backing up a bit, was everything kicked off when the two prime ministers spoke last month, and subsequently, I think it was our ambassador to Brussels and the EU, Santosh Jha, who had a video conference with you. If you could just lead us through what kicked it off.
Yes, absolutely. It was the virtual summit between Prime Minister Modi and Prime Minister Bettel from Luxembourg that really triggered the whole project. And the very next day, we were contacted by the ambassador of India to the EU, Brussels, and Luxembourg to participate to this project and really to start the entire challenge, because it really is a challenge, what has been proposed to us.
Mr. Doshi, what is this challenge that has been proposed to you, and what are you doing here?
Well, the challenge is to vaccinate 1 billion plus people, as you know, once the COVID vaccine is available. And we need to have our manufacturing facility up and running by March next year, which is 3 months from now. So it's an incredible challenge, but I think everything I've seen so far is all stakeholders, including both governments, are doing everything they can to make this happen.
Mr. Provost, I presume Mr. Doshi is referring to the manufacturing unit that we've heard about possibly being set up in Gujarat?
Yes, that's correct. And actually, timing could not have been better, because we are actually also on an extension project in Luxembourg. And so we had done a lot of work upstream on preparing the extension of our factory in Luxembourg. So for us, it was easy is maybe the wrong word, to copy paste that project in India. And so, of course, it has different challenges, but a lot of preparation work was ready and could be plugged in this project, which was extremely fortunate.
Mr. Doshi, you mentioned various stakeholders. I believe it's Niti Aayog, it's the Ministry of External Affairs, it's, of course, the 3 companies that are producing, hoping to produce the vaccine ready, we don't know when, in India itself. Tell us a little bit more of who you're dealing with.
Sure. So I think it's the Ministry of External Affairs, which of course began the project with us and is really helping us ensure that we get the right response at the right time across all ministries. So it is Niti Aayog, it is the Ministry of Health and Family Welfare in India, the vaccine manufacturers, DPIIT, which is promoting investment in the country, as well as several state governments. And I am from Mumbai, as you mentioned, and never before in my life have I ever seen something like this.
Mr. Provost, a little bit more about B Medical Systems. I do believe you were set up in 1979, and that's when the WHO approached the Swedish company Electrolux. But subsequently, like what, over 130 countries, WHO, UN, everybody is using your product?
Yes, absolutely. And it was a lucky event for us. This was the launch actually of the international EPI program, the Enlarged Program for Immunization. And since then, B Medical has been a market leader since the last 4 decades, because we had a big advantage, a head start, I would say, on competition. And this head start we have maintained thanks to innovation.
Mr. Doshi, we're seeing some of those pictures from your videos there. Could you explain what it is in particular that you're doing? Because it's such a crucial element. Everyone is just looking for the vaccine, but for the vaccine to move from the manufacturer, whether it's necessary through air or otherwise, and then finally to the final point of vaccination, the last mile, as he said, and it's all the storage that's necessary at very deep temperatures, sometimes even lower than Antarctica.
Absolutely. And perhaps just starting off with that, you have the Pfizer vaccine, which requires storage at minus 80 degrees Celsius. The Pfizer vaccine on average costs about $20. An ultra low freezer, which costs $10,000, can store about 200,000 doses. So you're talking about a $10,000 fridge storing 4 million worth of vaccines. And obviously, that means that the most important thing is reliability. Where we come in is really at the last mile, once the vaccine has left the manufacturer and reached the country, and ensuring that it's stored at the right temperature, whether it's minus 80, minus 20, 2 to 8 degrees. We can do each and every temperature, and we make sure that it reaches the person who needs to receive the vaccine at absolutely the right temperature. We also store and ensure traceability throughout the journey, so you can track back and make sure that the vaccine was indeed stored at the right temperature.
Mr. Provost, just to understand that further, so it's not the travel from the manufacturer, say, to the country of origin. In this case, when we're talking about India, it's post that you will come in.
Yes, exactly. So usually the manufacturers supply it to the, I would say, inland airport or port, and from there we kick in. So actually, we have the entire solution from the arrival of the vaccine in country. Of course, if it is produced in the country, it is that point of entry for the country that we consider. And then it's all the way up to the level where the people are immunized that we cover. And that's the uniqueness about our company. We have the entire solution, whatever the temperature and whatever the immunization structure is. If it's centralized or decentralized, we have the perfect solution to fit the different scenarios.
And these different scenarios, as Mr. Doshi will, of course, be well aware, are extremely different in India. But you have had experience in, say, in Africa to something like this, right?
Yes, absolutely. And in many national programs. So we have very challenging countries like DRC, Nigeria, Ethiopia, where we have equipped the entire country for national immunization programs. And so we know very much what these challenges entail. And we have a very robust product line, which has a very low failure rate, which allows us to be successful in such harsh and difficult environments. And that's, I think, the backbone of our entire solution. It's really the reliability, which stands out by far to anything that exists on this market.
Mr. Doshi, then again, just trying to understand that since that plant you were mentioning comes up in March, right? Or that's when you're expecting it in Gujarat?
That's right.
So in the interim, what if there is a need to supply the vaccine, you still have a solution for that?
Yes, absolutely. So at this point of time, we manufacture everything in Luxembourg in Europe, and we can supply always from that facility, as we are doing supplying to more than 100 countries right now around the world.
Mr. Provost, just you were talking about reliability now. The extreme temperatures that these need, and different companies have different ranges. There were reports that I read that you could have markers on the vials that indicate if those temperatures have been breached, so as to speak. Is that something that you're also working with, or is that something extra that needs to be done?
No, actually, that's, I would say, a second line of security, which is on the packaging of the vaccines. But your first line of security is to avoid to have temperature excursions. And that's where we come in. We make very robust products which avoid even in extreme conditions. For example, our entire range of products is tropicalized, meaning that even at 43, 45 degrees ambient temperature, you do not need air conditioning to make the units work. Our units work perfectly well in these tropical conditions. And we are the only product in the world who is certified tropical at minus 80, for example.
Mr. Doshi, if you want to add to that, especially since you've had experience of a similar sort, say, with the Mumbai Corporation, I think last month, or was it in September, where you supplied similar products, right?
That's right. So the PMC had started trials of the various COVID vaccines. And that's where we came in and we offered a solution. One of the other unique points, in addition to reliability, is that our units will never corrode because of the unique manufacturing technology that we have. And as you can imagine, Mumbai with high humidity, one of the biggest problems is corrosion, and fridges break, doors fall apart. And so I'm very pleased to have offered that solution because it's a solution where we provide a 10 years warranty as well as communication and traceability for 10 years. And it's all part of one single sticker price. And so as a consumer, they are safe, they are insured for 10 years with a perfectly working product.
Mr. Provost, since Mr. Doshi is talking about prices, could you give us an indication of your products and their pricing?
Yeah, well, I think it's difficult to mention prices because you're talking totally different products. For example, the transport boxes are maybe a couple of or $100, and you have -80 freezers, which is a totally different animal, totally different technology, which can go up to $15,000. But it's really the whole solution which makes it really cost effective because, as Jesal said earlier, I mean, the content of one of those freezers is several millions of dollars that you have inside. So it's really a low cost insurance that you are paying to secure all the upstream investment that has been made by the nation and which can guarantee, it's the only way to guarantee a quality immunization of the population.
And Mr. Doshi, the plant which you're expecting to come out by March in Gujarat, the numbers, of course, you're extremely familiar with in this country when it actually has to be put out, the vaccine there. The scales, you are able to deal with that, or does the government and whoever has to try and find that solution look towards other companies as well?
Well, we will try our best, but just given India's scale, uh, I think it would be unfair for me to say we as one company can provide all of India's requirements.
There's just a question that I want to take for you, Mr. Provost, from Tanuj Abe Khanna, who says, will one single, I think it's taking on from exactly what you talked about, will one single Gujarat facility help for our population, or these boxes will move to different hospitals and centers around the country? Because that, Tanuj says, sounds like a recipe for disaster. Mr. Provost?
No, actually, the interesting thing about our production technology is that you can multiply the capacity of a factory by multiples because it is highly linked to the number of toolings that you have, not so much the number of people and machines that you have. And so this rotomolding technology that we implement in the vaccine cold chain allows us to produce thousands and thousands of products a week. And that's the highly interesting factor about this production technology, which is unique around the world.
Mr. Doshi, of course, you know about Atmanirbhar. How much of what you're working with will involve Indian companies helping out in either some kind of in your whole supply chain?
So even by March, we are aiming for a level of indigenization at 80%. And over the next year, we will look at ramping that up to 100%. So it will be 100% locally sourced. Even today, as a company, we manufacture everything in the EU and its components from the EU. So typically, you have a lot of compressors, for example, being manufactured in China. And we've always stayed away and said that we want to make products made in the EU, high quality. And we intend to replicate that, but with a high level of local content.
Mr. Provost, if you can add to that, how much did the government and who you're dealing with actually make this one of the points for cooperation with you for giving you the contract?
Well, at this point of time, actually, it has not been imposed on us or requested from us. I think it's a logical step to take. I think Make in India is important for the country, but also for our company, because I believe it is the only way to rightfully serve the country and its population. India is such a large task in itself that it is the only way to go is to buy, produce, and develop in India.
Mr. Doshi, when you're moving it, and we know the difficulties, would a model that you have utilized, say in Africa, where you used solar refrigeration because electricity is such a Is that just checking, Mr. Doshi? You can hear me?
I can hear you now, Amitabh, but I
Yeah.
lost you in between.
I was just saying, solar refrigeration, which you've used in Africa, is that a part of what you do here? Because it is so difficult to maintain those temperatures when you have to travel so long in terms of distances into rural areas where there may not be electricity.
Absolutely. And I think solar for us remains one of our strongest technologies. But also, when you think about the push towards renewable energy and clean energy, I think solar refrigerators can play a huge role. And linked to this is also the fact that all our refrigerators use 100% natural and green refrigerants, which again I think is extremely important in the fight against climate change, for which on which I am particularly quite passionate myself.
Mr. Provost, talking about that, if you want to add anything to what Mr. Doshi is saying.
Yes, actually, I would like to add, because solar energy and solar solutions is one part of the solution, but we also have very unique solutions for AC powered units. And for example, our units are equipped with integrated voltage stabilizers, which allow to take any dirty or unstable power from 90 volts all the way up to 400 volts without risking any damage to the unit. And that's really, again, unique and patented by B Medical, to really show that robust solutions is for us the only way to go.
What I mean, the challenges that we know theoretically, of course, you've already would have tried to deal with. Once you've come here and you started talking to the various stakeholders, what are the difficulties that you are facing?
Sorry, Amitabh, was that a question for me?
Yeah, for you.
Okay. Well, I think, of course, public procurement is, I would say, it's not a challenge, but it is a process that one has to follow and respect, and we do that. But I believe where it's a bit unfair is the fact that when you have something which is truly unique and benefits this country, you are not allowed to bid in a procurement process when you're the only provider. And I it's a humble plea from my side that the country should look at that. When there is a company which can provide a solution which can mitigate multiple risks, can provide traceability of data, can work at pretty extreme conditions when nobody else can, perhaps especially in these current COVID circumstances, it's time to make an exception to make sure that the country gets served best.
Mr. Provost, if you want to take that a little bit further, because the question I was going to actually ask you before Mr. Doshi put that point across was, is there any competition? And if you could objectively answer that. But if you want to take up from where Mr. Doshi was making his point.
No, absolutely. I think there is always competition. But again, the uniqueness of our solution is that we have the global solution for the transportation, the storage in any temperature and any condition. And I think that's also a bit, I would say, the weak point of being the innovator on the market, is that we are bringing unique solutions which nobody else has. And to mention just one or a few, actually WHO has created new standards because we have created new products which did not exist before on the market. And so there was no regulation or no standards to qualify these units. And so WHO, following our innovations, created new standards. And I think it's a bit the same process in procurement. I think if there is a new technology available, it would be a shame not to benefit from that technology for a population if the final goal is to immunize the population.
Mr. Doshi, just getting into that a little bit more deeper to understand it, you're saying that the procurement policy in India, unless there's competition, it makes it more difficult, or it makes it almost impossible for you to do business?
Well, I think, and this is a well-known procurement policy where you do not have single bidders allowed. So that, and you can do that process multiple times to finally win a contract. But in today's time, you don't have the liberty of spending 6 months on a procurement, because by then it's too late.
So, Mr. Provost, then how did you overcome this procurement policy hurdle?
Oh, I think we are still here. I mean, it's our second day in India. So we are still discovering quite a lot of things and quite a lot of hurdles. And I think we need to take them one by one and communicate our message to as many people and institutions as we can, proving them the benefit of our solution for the population.
And perhaps if I can just
go ahead.
Yeah, if I can just add one point, Amitabh, what we are seeing is a huge amount of success with private organizations who realize the value and who, of course, don't have some of the constraints of public procurement. And there we are seeing a lot of success because eventually it's much better off to mitigate your risk to buy a unit that can store a vaccine at -80, but also at -20, just given the uncertainties around vaccine development.
Sure. So, Mr. Provost, is Mr. Doshi saying that private enterprises, companies, hospitals, anybody who wants to utilize this, including the vaccine manufacturers, there's been more positive response from them? Is that correct in my understanding?
Well, I think maybe not more positive. I think we, even from government, we're having a lot of positive reactions, and I think the vision of Prime Minister Modi is proof of that. I think there is a reason for which we have been invited and for which we are here. So I think that is not to be put in doubt. Maybe the processes are more simple in the private sector and make it maybe an lower market entry barriers than for the public sector. But I'm sure that we will be able to find solutions in the interest of the population.
So, Mr. Doshi, where are you currently in terms of the whole process? I mean, what exactly is happening, if you can understand that from me?
Sure. So we are on a road trip. We are in Delhi right now. We will be flying to Hyderabad in a couple of days, then to Mumbai, Pune, and Ahmedabad. And we are meeting various stakeholders, vaccine manufacturers, but also looking at potential locations to set up our facility. And joining us midway this week will be an additional team from Luxembourg, who are our manufacturing and ops specialists. And the idea is to not only identify a location that we can essentially a plug and play infrastructure. So we just go in and set up our assembly line. And we've also recruited our first few employees on the ground here in India. So I think we've made incredible progress considering that 2 weeks ago, nothing existed.
And Mr. Provost, I know the manufacturers themselves haven't given a timetable, but have they given you indications of when exactly they will need you to step in?
Well, I think the answer is yesterday, but we're doing as quickly as we can. So, I mean, this is a market today with the COVID where information is changing at an hourly rate. I'm not even talking about a daily rate. And we are in direct contact with COVID response teams of different governments. And from different governments, we're getting information that is changing every day that we need to adapt to. And it's very challenging times, and to really have a firm deadline is today, I think, not possible. And I think there will be even more surprises to come in the next few weeks, days, and months, because there will be newcomers in terms of vaccines that will have passed the third phase. Maybe new challenges in terms of logistics that we have not thought about. For example, the limitation of dry ice on airplanes. These are all details that need to be considered for national deployment plans.
And the difficulties, Mr. Doshi, does it mean each state you have to deal with different problems while you're trying to set this supply chain up?
Well, I wouldn't call them problems, but certainly there are issues. But clearly, it's becoming much smoother. And to be honest, I have never seen India like this in my entire life. So for me, that is an incredible achievement already. When everybody in Luxembourg says, wow, we have never seen a country moves as fast as India.
Well, Mr. Doshi, coming from somebody who's grown up and lived here in India, that is very kind words that we are hearing. Thank you for joining us. I do realize that you have lots of other appointments as well. Thanks for your time.
Thank you very
Thank
much
you,
for the
Amitabh.
And
Good
Mr.
evening.
Provost, thank you as well. And I hope you enjoy the Indian food if you like spicy food here, that is.
I love it. Thank you very much.
Again, Mr. Provost and Mr. Doshi, absolutely great having you with all the information that you're sharing with us. All the best to you, because the country and the world, I think, needs a very important part that you'll be playing in getting those vaccines out. Thanks again.
Thank
You've
you.
been watching StratNews Global. You can, of course, go onto our website to support our kind of journalism, and do follow our social media handles on Twitter, Facebook, and Instagram. This is StratNews Global. I'm Amitabh.